So, good morning, sir. I am Ashley De Alvaran from BSN 1B. And today, I am going to demonstrate how to do a proper bed bath or hygienic bath. Before we start, first, what is bed bath? Bed bath is bathing a patient who is confined to bed and cannot have the physical and mental capability of self-bathing. Next is, what are the purposes of bed bath? First, to cleanse, refresh, and give comfort to the patient who must remain in the bed. Second, to stimulate circulation and aid in elimination. Third, to provide an opportunity to inspect the patient's body for any signs of abnormalities. Fourth, to help the patient have some form of exercise and movement. And lastly, to provide an opportunity for nurse-patient interaction. There are also special considerations in doing proper bed bath that we have to remember. First, avoid unnecessary exposure and chilling. Second, expose, wash, rinse, and dry only a part of the body at one time. Third, use correct temperature of the water. Fourth, observe the patient's body closely for physical signs such as rashes, swelling, discolorations, pressure sores, burns, abnormal discharges, body lice, etc. Fifth, give special attention to the following body areas: behind the ears, axilla, under the breast, umbilicus, pubic region, groin, and the spaces between the fingers and toes. 6. Do the bath quickly but unhurriedly, and use even smooth but firm strokes. 7. Use an adequate amount of water and change frequently as necessary. And lastly, if possible, do such procedure as vaginal douche, even bed shampoo, oral care, etc. before the bath. Prior to the conduct of procedure, I have performed hand washing to protect the patient and myself as well from infection and cross-contamination. I have closed the door, fixed the curtain, adjusted the room temperature and ventilation, and provided adequate lighting to ensure my patient's comfort and patient's privacy. Remove unnecessary articles on the bed and clear up the working area. Arrange all needed articles within reach. Line a chair or a table with a newspaper or a piece of rubber where the basin will be placed. Lower the back and the knee rest depending on the patient's condition. Offer the bedpan or urinal as desired. Next is assemble the following at the bedside and arrange according to use. I have pitcher of hot water, body powder which is optional, deodorant which is optional, patient's gown or pajama, bath blanket, bath basin, soap in the soap dish, rubbing alcohol or body lotion, bed screen if in ward, newspaper or rubber sheet, bath towels and face towels and gloves. So what I'm gonna do now is to introduce myself to the patient and verify the patient's identity using two identifiers, which is that make sure that I am doing the right procedure for the right patient. And of course, I have to explain the procedure to the patient that I'm about to do. So, good morning, sir. I am Ashley Alvaran, your student nurse for the day. May I know your name, sir?
Tirlaya Albaran.
And your birthday, please?
June 2, 2011.
Okay, thank you. So, today I am going to do your bed bath, which means that I am going to wash your body and remove the accumulated dirt and oils or perspiration in your skin, and of course, for you to feel refreshed. Is that okay with you, sir? Okay, thank you. So, I'll begin now. So, now we will now proceed on doing the procedure by wearing our gloves first. So, naturally, in the hospital, I need to raise the bed in a comfortable working height and lower the side rails of the patient near my side. After that, I have to assist my patient to move near my side. Okay, sir, I will move you a little bit like this. After that, I'm going to get the bath blanket. But before that, I need to loosen the third linens. that, I can replace it with the new linen or bat blanket. And then after that, remove now the soiled linen. And then after that, we will now remove the patient's gown. Okay, sir, I need to remove your patient's gown. Always keep maintaining to keep the patient's privacy by doing it under the bat blanket. Next is fill the basin with 1/2 2/3 full of a comfortably warm water. An adequate amount of water in the basin ensures good rinsing. The use of warm water prevents chilling. Check the temperature to make sure it is not warmer than 115 degrees Fahrenheit or 46 degrees Celsius. If you do not have a bath thermometer, it should be comfortably warm to your elbow. And then after checking it, place a bath towel under the patient's head and the second one over his chest. To prevent the bed linen from wetting and the towel becomes readily available for drying the face. Okay, sir, do you wear contact lenses?
No.
Okay, thank you. I'm gonna start on washing your eyes first. So, in washing the patient's eye, the first thing to do is to soak the washcloth or face towel in the warm water. Squeeze out the excess water thoroughly to prevent wetting of the bed linen. And then wrap it around the palm fingers to form a mitten. Arranging the washcloth in the fashion prevents the corners from dragging over the patient's head. So, in bathing the patient's eye, use a wet washcloth without a soap. Then now gently wipe an eyelid by wiping the inner canthus to the other canthus. And then pat it to dry. After that, we will now proceed on washing the forehead, cheek, nose, chin, neck, and ears. So, sir, would you like to have soap in washing your face?
No.
Okay, and then do again the wetting the washcloth. Squeeze it and wrap it again. So, starting from the forehead down to cheek, and then the nose, and then do the other side, and then the chin and the neck, and then the ears, front and back. And then pat and dry. So next is I'm gonna have to place the towel lengthwise to the father's arm. And if there's an ivy line, do not disturb it. Now that I have a wet washcloth with soap, start now washing his arm in a distal to proximal manner, which means from wrist to elbow and from elbow to shoulder, and then the axilla. And then dry it. Make the patient raise his hand so that I can clean the axilla. And then dry it again. Use a deodorant if necessary. And then after that, we will now wash his hand. Get the bath basin together with the newspaper. And then put the hand gently and thoroughly. And after that, dry it again. Now that I have done washing my patient's left arm, which is the farthest side, I can now proceed on the nearest side, which is his right arm. And do the exact same step like what I have done on the left arm. And after that, wash the hands. And then after that, I am now going to proceed on bathing my patient's chest. So what I have gonna do now is to drape the bath towel across his chest while I am lowering the bath towel just above in his umbilicus. And then I am going to get my wet washcloth. And now that I have my wet washcloth with soap, I can now start on cleaning my patient's chest. Apply it in a rotational movement. Pay attention to the skin creases, especially for cleaning, under the breast, and then rinse it and dry. And now I am now going to proceed on his abdomen. I am going to drape another bath towel over his abdomen. Move the bath blanket downwards in his suprapubic region. Now start washing my patient's abdomen. Washing my patient's abdomen, I'm going to keep it covered with a bath blanket. Pay attention to the umbilicus and surrounding skin tone. And then after that, remove now the bath blanket while maintaining the patient's privacy. So now that I have done washing my patient's chest and abdomen, I am going now to proceed on washing my patient's legs. The first thing to do is to uncover or expose the farthest side of the leg by folding the bath blanket in the midline, keeping the perineum covered, and then place the bath towel beneath his leg. And after that, I am now going to start washing my patient's leg. Using long, firm strokes, starting from the ankle to the knee, and to the knee, and from the knee to the upper part of the leg. And then after that, we will wash the feet of the patient by getting the bath basin. Paying attention to the spaces of the fingers of the toes. After that, dry it. And then after that, repeat the procedure on the near leg. So now that I am done with my patient's anterior side of the body, I am now going to discard the washcloth, the water in the basin, and my gloves, and replace it with a new fresh one. So now that I have done a new set of gloves and I have refilled the water in the basin with warm water, check, I am now going to assess my patient in a prone side lying position so that I can wash his back. Okay, sir, I need you to face on your left side so that I can wash your back, okay? And then expose the back, including the buttocks, and then get the bath towel and spread it on the side of the bed. After that, I am now going to wash his back gently and thoroughly from the knee and then dry it. After that, if the patient's skin is intact, ask the patient if he'd like to be given a back massage. Sir, would you like to be given a back massage? If not, then apply a corticosteroid. And then help the patient to return to his defined position. Okay, sir, I will now wash them. And then after that, we will now proceed on washing his pubic region. But before that, ask first the patient if he desires to be cleaned. Okay, sir, would you like for me to clean your private area?
No need, I'm fine. Thank you.
Okay, thank you, sir. That is. But if the patient gives you permission to clean his pubic region, change the water first in the basin before you wash the genital area. The genital area is the last area to be washed. You may need to bend the patient's knees to reach the area better. For women, wash the genital area from front to back. And for men, make sure you wash around the testicles. And then after bathing the patient, we will now proceed on the aftercare. Provide a patient's gown or pajama. Replace articles after cleaning. Discard dirty water. Clean the bed linen if needed. Position the patient for a comfortable and proper alignment. Okay, sir, I will now go back here. Cut short the fingers, nails, or 2 nails if necessary. Comb the hair and arrange the hair. And then after that, wash our hands again. And then the last thing that we need to do is to record the procedure in the nurse's record with time, date, type, and abnormalities notice. And that will be all for doing a proper bed bath. Thank you.